welcome to the Recovery Roundup, our monthly exploration of sobriety, community, and well-being. My name is Carrie Dury. I'm the Director of Business Development here at Calvary Healing Center. And today we are joined by April Halloran. She is our Director of Nursing here at Calvary. So thanks, April, for joining.
Thanks for having me, Carrie.
So today's topic is seemingly very timely and appropriate. With what we're seeing not only nationwide, but specifically here in our state of Arizona. COVID cases are back on the rise. We could argue that some predicted this, we knew this was coming, but here we are. Just 2 weeks shy of a holiday too, which is going to be really crazy for a lot of folks. So I wanted to get your insight a little bit on some of the testing at Calvary that we're doing, some other guidelines, things that we're going to be looking at moving forward, what's worked, what hasn't worked. So we'll just kind of walk through some of that today and get your insight on that. So I guess we'll take it back a little bit. I know for those that don't know, April is relatively new to Calvary. I think this is like what, month 2 or 3?
Getting ready to start my 3rd month.
3. Okay, so I know you weren't with us at the early portion of the pandemic, but I know you had plenty of insight to what we were doing and the testing, the COVID-19 testing that we were providing. So can you tell us what was originally being done, the screenings, the testing, and moving patients through the admission process during all that?
Sure, absolutely. So typically when a patient is admitted here, nursing will do the initial COVID screening. Prior to about a month ago, we were doing the screening where, you go in and you have the swab put up your nose and it goes up pretty high side. And then that goes out to a lab. And it could take anywhere from 3 days to 5 days. Typically, it was somewhere in between there. Occasionally, it could be longer. I think when COVID first hit everywhere, some tests were taking even longer than that, but typically it's about 5 days. And then if a patient screened positive, we wouldn't admit them. We would either, depending on their symptoms, either recommend that they seek a higher level of care, or we give them, resources and then send them home. As you know, most people then are quarantined at home, and then we would require them to test again and test negative before they can come here at Calvary for treatment. And the reason why we do that is because our care here is a community milieu setting. And so our patients, they interact with each other, they go to groups, they eat together, they play games together, so they're constantly interacting. We do keep the social distancing here the best that we can, and then we require our patients to wear masks, but we have to keep our patients safe, keep our staff safe, and so we can't bring somebody here that's positive. The nice thing is, about a month ago, we got a new tester. And it's just a small little tester, but the nice thing about it is that this small tester will test in 15 minutes. And so our potential patients can come in. We do the COVID same swab on each side of the nose. It's kind of nice because it doesn't have to go up so high, which most people like, because nobody likes their, feeling like their brains are getting touched.
It's terrible. It is, the most uncomfortable thing. And for those that haven't had it,
Yeah. And then it's bad too when they stick it so far up there and the person sneezes, right? Because a lot of times it will make a person sneeze. So this new tester that we got, like I said, about a month ago, it's just a small tester. We do the nasal on each side, just not as deep as the original one. And then we stick it in this solution and put it on this little tester that goes into this machine. In 15 minutes, we have results.
It's incredible.
Yeah, which is really nice that, we know whether or not a person is positive or negative in 15 minutes. And so it's, I believe, it's over 90% accurate. And I think that's pretty much what the other ones were as well. So I believe they're very comparable in their accuracy. But again, the nice thing with this is that we bring the patient in, and if we were waiting 5 days, we potentially could have had somebody that was positive and then expose all of our patients and staff. So this way, we know right away, and then again, we can give them the resources to either go home and self-quarantine or go to the hospital. So this is great. This is really great. You know, I mean, we're obviously on our way to getting better resources and tools to use so we can identify this faster in the community. So this is really good for us.
I 100%. It's unfortunate that, you know, no one could have prepared and planned for what's gonna happen in earlier part of the year. But as months go by, there's technology around the clock, as everyone knows, is well aware of these rushes for vaccine. But, you know, for us, it's more about, you know, just controlling with the environment that we're presented and keeping Calvary safe. So while we were able to do it to the best of our ability before, this is almost in real time. And I think it provides a lot more comfort, not only to staff, but to our patients. I mean,
it does.
It seems to, you know, have that ability just to say, you know, yes, cleared, you know, ready, you're able to admit into our program, or actually, you know, no, heaven forbid, it is a negative test. Here are some resources. So I know your nursing team is well equipped to handle all of that, but this is a nice new feature.
That is correct. Yeah. And I mean, we have the PPE if we were to have somebody that tested positive, but hopefully with this new tester, we don't even have to risk that. Obviously, there is that small percentage where somebody could come in and have COVID, and we're ready for that. We have an isolation room that's a negative pressure room, which is the same thing like the hospitals would have. And then we have all the PPE to keep our staff safe. And then we would do our best to either get them to a higher level of care, or again, give them the resources and discharge them safely to go home.
Speaking of going home and seeing loved ones, I know there's been some discussion amongst a lot of folks over at Calvary about what it's going to look like as far as visitation and having families stay connected with their loved ones during the holidays. But I know we've pretty much come to the conclusion that with cases rising, infection rate growing all throughout the country, it's really in the best interest, and the patient, staff, everybody that knows someone at Calvary, whether they're working there, they're a patient there, that we keep that really limited, and or just have to cancel it altogether, which I know is really unfortunate this year, but it seems like par for the course for 2020. Another thing that we have to just be really, really careful about.
Yeah, it's unfortunate because as we know, one of the biggest things for a person coming through treatment is their support system. Because when you leave here, that's what you're going to need, is that really good support system that you have. And we want families to be involved in the programming. We want families to understand what addiction is and sobriety and the road to recovery. Now we just have to be a little bit more innovative in the ways that we do things. So we offer telehealth here. It's, you know, we can look into offering, you know, visiting time with your family that's done, you know, over FaceTime or, you know, Zoom calls. So we do have those capabilities, and some people already are doing that. You know, obviously it's not the same, but it's kind of almost the way things have been for a while. So we encourage people to stay in contact with their family, obviously over the phone, like they've always been able to do. But, you know, we give them that time so they can still see their families. And the holidays is always going to be hard. You're in treatment, you're here for, you know, 30 days, and you've already made that commitment to yourself. and a lot of times to your family to stick it out for the 30 days. So a lot of times holidays are hard for our folks here, and now it's going to be a little bit harder because they're not going to have their support system and family here.
Yeah, which is a whole nother topic and probably one that we can't get into today, but right, the support system and keeping that intact through all holidays, through this time of year, you know, forever. It's always something that triggers come up, and the support system that's intact or not intact is so much goes into that, and kind of building that infrastructure around these patients to maintain sobriety. And then this new normal that we're in, the first time we're going through holidays, having to live through a pandemic in our lifetime. So it'll be an interesting, another barrier, another challenge that we are not afraid of, but we'll get through it, but we can really like add it to the list. Any other updates, April, as far as, you know, the masks that we require our patients and staff, or keeping social distancing through programming, anything else there that we didn't touch on?
Well, we're doing the same thing here that I think everywhere in Arizona is doing, is, you know, keeping a mask on, because we know not only is hand hygiene one of the most important things for not transferring viruses and illnesses, but right now it's also masks. And so all of our staff are required to wear masks, and then we encourage patients to wear masks. We don't mandate it, but we provide them the mask, we provide them the education, and we always are giving our clients reminders if they're not wearing it, just to keep themselves safe and keep others safe. And, you know, we've never had problems with patients not respecting that and doing that. I think everybody understands the importance of that. So I think, you know, we give the surgical mask to the patients, and I think, you know, they don't get to wear the fun mask here, which sometimes on the outside does make it fun, but they understand why they're having to wear them. Generally, we don't have problems with it.
Exactly. Well, hopefully, you know, maybe in 2021, maybe we'll come out on the other side of this a little bit differently. So I'll be curious to chat with you in a couple more months. Maybe we'll have some new updates and new technology. I'm certain there will be. So you know, archiving this video, it'll be fascinating to look back at in years to come, where we were moving into the holidays in 2020. This year has been such a wild year for so many of us, and what you thought was the normal just isn't, and, you know, approaching travel, holiday, all of this stuff. Everyone's kind of relearning this and figuring out what is best. I don't know about you. I know for us, family gatherings, and I mean, everyone kind of canceled it. So it's just immediate family, or, you know, your immediate household, which for me, that's really bizarre. You know, it's kind of a bummer, but I guess we'll get through this. This will pass just like everything else. So as long as we can get through this, I think we'll be all right. But going out with 2020 with a bang, for sure.
That is true.
Sure. All right, April. Well, I appreciate you taking time. I know you're so busy over there, and we appreciate all that you do, and your team. They're phenomenal. They keep this place running every day.
That's true. That is true. Our healthcare workers are definitely the heroes here. So
they are.
I have a great team of nursing staff and leadership, and just overall a great team to work with here at Calvary. So thank you for asking me to talk with you today.
Thanks. Thank you so much. We're so happy that you're here. Thanks everyone for joining. We'll see you on the next episode of the Recovery Roundup. Bye.
All right. Bye.